Hi, I am Rowena Nikki Baisa, and I am better known to my friends and my family as Nikki. I am currently in Maui, Hawaii, and this is my house, this is my porch, this is what I see every day, this is my sunshine. Um, I have a very almost a 360-degree view of the city, the ocean. I have the mountain, I have Eo Valley, and it's just fabulous here. I moved here in Maui about 4 years ago, and I love it here. My husband grew up here in Maui, and we knew that we were going to come back eventually here. At any rate, I am working at a tertiary hospital here in Maui, Maui Memorial Medical Center. I am their American Heart Association faculty, which just means that not only do I teach providers advanced cardiac life support and pediatric advanced life support and their BLS, but I also train prospective instructors to teach those classes. I am also the clinical educator for their critical care and their progressive care units. I am heavily involved with their stroke program as well. I do volunteer a lot in a lot of community projects because prior to this job, I was actually with the Department of Health and the Office County of Aging, and we dealt with a lot of wellness programs and education in the prevention of non-communicable diseases. My previous years, I've been a nurse for 30 years, and the beginning part of my career was involved with communicable diseases. I was the infection control. I'm sorry. I was the infectious disease research coordinator for University of Florida for a number of years. I was also a nurse epidemiologist for a five hospital system in Jacksonville, Florida, which is the Baptist Health System. And then at the turn of the century, I switched gears. I've known that the global and our national disease burden for communicable diseases was dwindling down. Thank goodness for public efforts regarding the mitigation of communicable diseases. So I switched gears from communicable diseases to non-communicable diseases. So my stomping grounds have been emergency department and critical care. That is actually where I see my future going to. As a nurse practitioner, I feel that that will be my niche, especially here in Maui, Hawaii. We do have a large disease burden for non-communicable diseases. Um, we have about 85 to 87% disease burden for those, and only 15% for communicable diseases. Our public health efforts have been so very successful in the prevention of spread of tuberculosis, of and other communicable or infectious organisms. Although it's still palpable, but currently what we're battling in this community are the non-communicable diseases. We also have a big migrants coming from the island Pacific, or the islanders, or the Pacific areas, Samoans, the Micronesians, and then when they come, oh my goodness, they do have multiple problems with cardiovascular diseases. So right now, our efforts are in educating the public on how do we prevent these, how do we prevent strokes. As a nurse practitioner, I think that's where I'm going to be going to. So most I'm thinking that most of my papers will be dealing with a lot about non-communicable diseases. Thank you, and aloha.